Hello, everybody. This is Chuck Wiger, Area State Senator, and today we're going to meet with Dr. Will Nicholson. He's the Chief of Staff at St. John's Hospital. Welcome.
Great to see you again, Chuck.
And St. John's, a part of the Health East Fairview Health chain, if you will. And maybe just for the viewers, tell us about St. John's and how it all fits in the delivery of health care in our area.
Sure, absolutely. That's a big topic. But let me tell you first about kind of how it fits in for me. You know, I grew up about 4 miles from St. John's Hospital. I trained there as a physician. I'm a family doctor, and I've never left. I've been there for 10 years in practice. And what I do there is...
Were you born at the hospital, too?
I was not.
Okay.
I was not. Unfortunately, that was...
But
I'm not quite that young. But
I was born at St. John's, but it was the 403 Mariah.
That's right,
downtown
St.
Paul.
So
that maybe there was some flexibility there.
That's
but
right.
Anyway, you're close to home.
So I'm close to home, and I believe in community medicine. I love our community. I take care of my neighbors, my friends, my family members, and you know, my job is to make sure that we have the best community hospital in the state, because that's what my friends, my neighbors, and my family members deserve.
Wonderful.
St. John's is a part of a larger health system that previously was limited to Health East, but we've recently merged with both the Fairview Health System, and the University of Minnesota has also built a partnership with us as part of Fairview. So it's a really exciting time to be working as a physician there and working in leadership because there's so many opportunities to sort of expand and improve the care that we deliver to the people of our community.
Okay. So many of us are very aware of the hospital in Maplewood, which has quite an area that it serves, you know, in the East Metro for sure.
Yeah.
And, you know, tell us about, and of course the big clinic, professional service building across the street. And all of this is about 2 blocks from me, so I walk by it almost daily.
Right.
Great. But tell us about the programs that are offered through the hospital. We have the traditional type services, but tell us where the hospital is at in terms of its delivery and where it may be going.
Sure. So for just in general, the job that we have at St. John's is to deliver the care that our community members need most. And to that end, as a hospital, we've developed one of the busiest ERs in the Twin Cities, a very robust inpatient general medicine service to care for the people that come in through ER. And then we've also specialized in a couple areas of highly focused medicine that include obstetrics and gynecology, with an emphasis on now adding maternal fetal medicine, so we can take care of more complicated and sicker patients closer to home so their families don't have to travel. We are growing a robotic assisted surgery program that started out very small, pioneered by some of our local urologists and other surgeons. We're now up to 3 robots, and we're doing a lot of innovative work that is minimally invasive, has faster recovery times, and gets great outcomes.
The robotic surgery, tell us more
So
how
the
that works.
surgeon is on one end driving a robot that has tiny, tiny instruments that does all or part of intra-abdominal, intrapelvic surgeries. So they don't need as big of incisions. People heal faster. It's a highly specialized form of medicine, but it's really an exciting thing to be involved in. It's a great thing to be able to offer folks around here. We've also built a health campus because it's not just a hospital. It's about having the clinics and the follow-up capacity and keeping people healthy so they don't have to go to the hospital. And our health campus has expanded, and it is diverse. It has a lot of specialty groups. We've just added some durable medical goods. We're expanding our cancer care capabilities. And we're just really excited about the potential for growth there as well. It's a place where not just traditional Health East and Fairview doctors have gone, but we're now bringing in the University of Minnesota team. We have a maternal fetal medicine and a really advanced ultrasound suite for moms to get good looks at their babies if there's any concern about their health. And so we're really trying to build the whole bench of medical specialists that our community needs right in one spot, so it's convenient for people.
Great. How many employees just at the St. John's Hospital, or approximately? And maybe just start with physicians. Of course, you have on staff, and then persons with privileges, et
So
cetera?
it's a big that's a big staff because many people rotate through. So at Health East we were sharing a lot of physicians, and so we had about 500 physicians rotating through, and then a total of 1,500 employees, all said and done. In addition, we have a ton of students as well. So you have the trained professionals,
Yes.
and then we have a bunch, and we're very proud of these, a bunch of education programs. So we're educating nurses, nursing assistants, lab techs, pharmacists, pharmacy grad students, doctors like me, fellows.
Great,
all
so
kinds of
partnerships with most any higher ed.
So the employees only tell part of the story, and now
Yeah.
with this partnership with the University of Minnesota, we're looking to
Yes.
expand to even more of that, to train more nurse practitioners, more physician assistants, and looking at all those opportunities. We don't have anything set up yet, but that's where we're going.
Excellent. Well, that's one of my highest legislative priorities is preparing the E12 students for the workforce and the higher education opportunities, but a pathway and having mentoring programs. The training directly is the best way to do it, and so that's
I want everyone to have the
encouraging.
same opportunity that I've had. The value to me of living in my community, getting education in my community, being able to turn back and serve my community has been tremendous, and I really want everyone to be able to train where they live and take care of the people that they care about.
Tell us about prevention efforts that St. John's and Health East Fairview would be involved in terms of the wellness campaigns.
So there's a ton of work on prevention. Unfortunately, the hospital is a place where the sickest people
Yes.
go. So sometimes it's when prevention didn't happen or didn't work. Sometimes we do everything right and people get sick anyway. The biggest effort we're working on right now, which is a slightly different take on prevention, is making sure that when people come to us for a surgery or a hospitalization, when we get them better, we get them done with their procedure, we make absolutely sure that everything goes well after their discharge so that they don't come back with complications or other troubles, that their follow-up plans are crystal clear, that everyone's on the same page, and that they have the appropriate check-ins so that they get back to full functioning and full health right away. We've always done a good job at that, but there's always room to improve, and with new technology, broader partnerships that we have, we're finding new ways to help carry the patient along and make it simpler for them to do the recovery and to make sure that everything's going right. Make their medicines more clear to them. Right now we have an outpatient pharmacy that we just built so that when you come to the hospital, if you need a new medicine, I can put it in your hand before you leave so you know you have the right thing. You don't have to talk to your pharmacist. You don't have to make an extra stop. You don't have to argue with the insurance about it. So those are the kind of things that we've identified as gaps to staying well after you've been in the hospital, and we're addressing those.
Probably the top issue in our state, and if not nationally, is on affordability for health care. And you certainly you hear that and are part of what can be done to address that. Your thoughts on the affordability for health care and what we can do as policymakers, and that's probably a long discussion, but just some general thoughts as to addressing healthcare costs and access.
Well, as I said at the beginning, I'm a family doctor, so I work in a hospital, but the most important thing we can do is take really good care of people. Keep them healthy, do the screening that's proven to work, and keep them out of the hospital if at all possible. That's where the biggest bang for your buck is. The community supporting people as they age is another huge benefit. We have a tight-knit community of people that care about each other. And then education, graduating high school, is one of the most important things you can do for your health. So big picture, there's a lot of things that we can do to keep people healthy. As far as keeping costs down once they need to access health care, that's something that we spend every day looking at and trying to gradually reduce the cost of care. Well, we have to do it without impacting quality. So we sit there and look at every step of a process and say, okay, what's essential here? Part of it is having the time to care and to listen. Part of it is making sure that we have all the best outcomes for people based on the best science. And then part of it is, okay, if we're doing both of those things, how do we keep a lid on the cost so that the maximum number of people can benefit from the services that we offer. I don't think there's a magic pill. What we need is a big bench of talented people to keep working on it, people whose heart's in the right place and are focused on it just like you are, because we know that it's harder and harder for people to access and afford health care.
Okay. As chief of staff, you have a lot of meetings? And right?
So I'm talking to a politician though, so it's probably all relative, right?
Yeah, but and tell us about the types of meetings and committees, and then how much actual patient care are you still able to do in that role? Because I would imagine with such a large organization, it presents a lot of challenges.
Yeah, so
and I know you have a family
continuing to do frontline patient care is the most important thing that I do.
Okay.
If the further you get away from the front lines and the patient's bedside, I think the further you get away from what's really important. What's really important is you trusting me to help take care of you when you're sick. I do spend a fair amount of my time in meetings, but we don't go to meetings just to go to meetings. We go to meetings with an objective. And the biggest chunk of my time is really spent on teamwork, on how do we get nurses and administrative people and the people doing the food service and the specialists and the hospitalists and the clinic doctors to work better together. It's a highly complex thing we do in healthcare. It takes so many little steps. And the better the team works, and the bigger the team can be now that we've added Fairview, now that we're bringing in talent from the university, the better care, and again, the more cost effective we can be. And when all the parts are working together with the same clear goal in mind, that's when we really get good outcomes. And again, we're so lucky to have had a hospital and a medical community that was built far before I got there on that kind of teamwork, on caring about the people around you, and on taking care of patients like they're your own family members or or your neighbors, because they are.
Yeah. Does the hospital have a website with information about the services or tips, things like that? We see a lot of self-diagnosis that people will make sometimes, or what to do, or health prevention efforts. But is there a website that?
Yeah, we have just recently merged our website, so we're through the Fairview website right now. So you go to fairview.org, I think, fairview.org, but I would encourage that whatever you find out on the internet, check with a physician or a medical professional before you make any decisions about your health care. But there's so much out there.
Have you ever looked at any of those, or just to check and see what they're saying?
I do look at them. I do look at them, and they're valuable in the sense that they can give you information. But great health care isn't about knowing information. It's about making the right decision with that information. I bet that's a lot what being a state senator is like too, right? Everyone has access to the same information. It's how do we get the team to make the right decision that's best for everybody.
Wonderful. With the changes in the future, it's got to be very exciting. And
Absolutely.
Just looking at the campus that you have in Maplewood, is there much room for expansion there?
Absolutely.
I can see a couple of potential areas. Is there a vision that you're able to share yet as to what that might be?
Our first order of business is to expand our obstetric service. It's a very popular service. It's a growing community, and we need to have more capacity there. So we will target growing our obstetric service.
Okay.
The other thing is just trying to add in more of the non-hospital services that people need to the campus. We can always grow more, but we want to make sure we're delivering the right services and the things that people need, not just adding stuff because it looks cool or because the other guy has one or something like that. One of the great things is we can grow without growing by increasing our partnerships with larger, like other hospitals, other specialty groups, and that's why we started this journey with the Fairview organization.
Yeah. And there's a foundation, a philanthropic part of the hospital as well. Tell us about that.
Absolutely. Well, as you can imagine, many people that go into healthcare, whether they're treating patients at the bedside or helping with operations, they go into healthcare because they have a strong conviction about helping people. And so every year we do a system-wide fundraiser to try to raise more support to fill in the gaps for people who maybe don't have all their needs covered.
Right.
Because as you know, healthcare is complicated. People's needs are complicated. And some people have special needs, and we want to be able to accommodate those as well. So it's an exciting thing to do. I think it works with our mission, and it is also a good example to set. You know, it's great to have an organization that's focused on giving, because you remember it's not just about you. What's really important is the person who needs the care. We're all pretty lucky. We're relatively healthy. We're trucking along. And somebody's having the worst day of their life in some of those hospital beds. And it's great to work with an organization that says, yeah, not only are we going to deliver the services that we're contracted to give, we're going to do a little more too.
And there are volunteer opportunities.
Absolutely.
Sometimes when you enter, and tell us about volunteer opportunities for
volunteers
people.
are my favorite people in the hospital. They bring an amazingly tremendous amount of energy and talent in. We try to hold on to them. We try to help find them places to get education and to stick with us. We've tried all different things throughout the years, but it's all about, again, bringing in the community and helping people access our hospital, the services we offer, and maybe start thinking about, if they're younger folks, start thinking about, well, what kind of career could I have here? What could I do? Could I be, an EMT and work in an ambulance, or a phlebotomist, or go to medical school? And we look at that as an important part of our mission as well, to educate the public.
I'm curious too, is music or animals, like dogs, are they part of the treatment that a person might get in terms of that type of therapy?
More and more. Yeah, there's more and more of that. When I first started, those were limited things. At all three of the Health East hospitals, we've done different kind of experiments with that. Therapy animals, if they're trained, are welcome to come, and we actually do have pet therapy. We do have a harp player that comes sometimes, but the one thing that I think has been the most interesting, it's a small thing, but it's been really positive, is when a new baby is born, they play the chimes of the lullaby song, just the first couple chords, throughout the whole hospital.
Oh, okay.
And so everyone gets to hear that and think, it just makes you check yourself a minute and go, wow, there's a new life in the world. So even if you're thinking about something else, that little moment of joy is shared throughout everybody's day.
Wonderful. Well, I thank you so much for sharing about the progress that's being made, and even greater things in the future. On a personal note, you mentioned you're local, and I recall that you had lived in Maplewood as well. And
that's right.
Your
That's how we know
spouse
each other, right?
was Mrs. Maplewood.
That's right.
Very active as
Very
well.
proud.
And then tell us a little bit about her and the family.
Well, my wife, we now have a 3-year-old and an 8-month-old.
Okay. And everybody's name?
The 8-month-old boy's name is Conrad, and the 3-year-old's name is Viola.
And your bride.
And Leah is my bride. That's good. Thank you for getting that in there. I get in trouble. And they're doing really well. She's right now focusing on taking care of the very energetic kids. And then she volunteers at the PTA. We've had a really amazing experience with the local early childhood resources and education.
And that's, I know for the White Bear School District, newborns, I believe, are given a onesie.
Yeah, knock me for a loop there.
But it's from the school district, and then there's information about early family education. In fact, over further, I've got some of those. But it ties in the importance, not only during the natal treatment and education, but then after the birth and getting involved in early ed. So
we're big fans. Both the value to our child and to us with the education, and then just from the medical standpoint, I know how important high quality education is from the moment of birth, not just for babies, but also for parents as well. I mean, there's not like a great manual for how to be a great parent and get your kid ready for school.
Yes.
And these early childhood programs are just amazing resource. So we've been very, very excited to work with them.
Wonderful. And
Yeah.
is there time for hobby or hobbies?
Chasing kids around? Yeah.
Okay.
No, I think our main hobbies are, water skiing on White Bear Lake and cross-country skiing in the winter. So our favorite things to be outside.
Well, excellent.
Yeah.
Well, Dr. Will Nicholson, Chief of Staff at St. John's Healthies Fairview System, thank you for your service, and I encourage our viewers to contact you or the hospital. Is there
Absolutely.
a contact number that they might be directed to, or a website
Oh boy.
that you recall? They can Google, obviously.
General information at St. John's Hospital, I believe, is 651-232-7200.
Yep,
I haven't
sounds
called
very
that in
good.
a while, but I think that works.
No, that is correct, and I encourage people to do that. Navigate that website as well, and to take the advice that you offered. Great suggestions, and I will look forward to the progress that you make in the future. It's a tremendous asset to our area.
Well, thanks for all your hard work and your great collaboration. It's a pleasure.
Thank you, Dr. Nicholson. And viewers, if you have a question, suggestions for me, give me a call. My cell phone, 651-770-0283. This is Chuck Wiger. Your health is your wealth.